Good evening and welcome to the September edition of our support group for breast cancer patients. And I would like to welcome our viewers as well as our two guest speakers. Welcome, Dr. Chantelle Scott is the genetic counselor at Panorama Center for Surgical Oncology, and she's going to talk to us about genetic breast cancer. And then also liezil Basson. Liezil is a professional photographer. She's also she's the founder. I don't know. You started a non-profit organization called Women of Hope. She's going to tell us a bit more about that. And she's also a breast cancer survivor warrior, and she's going to tell us a bit more about her journey with breast cancer. Welcome. And I think we're going to start off by asking you to tell us a bit more about genetic breast cancer, Chantelle.
Thank you. Welcome everyone. So I'm going to do a brief presentation about hereditary breast cancer. So I'm not going to go in too much detail because I still want this to be interactive and I want us to sort of have an informal discussion about questions. Because I have to say, as a geneticist, I don't always know what other people don't know. So it's nice if I get questions from somewhere else.
Yes, and on that point, I'd just like to say, if any of our viewers have any questions, you're more than welcome to send it in, and Ruben will read it out for us.
Okay, I think, can I start the presentation? Yeah. Just trying to move the slides, but I can't.
Can you try now?
Perfect. Okay, so just a brief summary about what causes breast cancer. So as you can see, the majority of breast cancers, about 70 to 80%, is due to sporadic causes. So that's all the environmental things we always talk about. So as you get older, smoking, alcohol, even lack of sleep, all kinds of environmental exposures, if you're overweight, radiation exposure, if you haven't had children or if you never breastfed, and all the hormones that we also have in our bodies as women. So we don't really have control over those factors, or the majority of those factors. And then we also have a group, 15 to 20%, that's due to familial causes. So that is a group of individuals where you see that there is a strong family history. So you will have breast cancer and your mom was diagnosed with breast cancer and your grandmother was diagnosed with breast cancer, but we've been unable to pinpoint the exact cause. So we don't have a name for the gene that's in that family, because we do have a few of those families as well. And then I will be focusing on the last group, so that 5 to 10% that's known as hereditary breast cancer or genetic breast cancer, because we actually know what the causative gene is. So, or causative gene variant, obviously it's not the gene, it's a faulty gene that causes the increased risk for cancer. So that is usually the most well-known genes, is that BRCA1 gene and BRCA2 gene that I'm sure most people have heard of. And then there's also a few others that are well less known. So that's just a list. So there's like ATM, CHEK2, BOD1, P10, NBN. So there's quite a few. There's about, I think, 28 in total at the moment. So I'm not going to list all of it. So then I just also want to mention like what clues are there that sort of makes you think that your breast cancer is more likely to be hereditary or even familial. So that's just a family history diagram that we usually just draw. So just for those that haven't seen this before, so the circles are the women, and then the squares are the men, and then the squares or circles that's actually colored in, those are the family members who have been diagnosed with cancer. So one of the clues that we look at is if we look at your age of diagnosis. So if you're diagnosed with cancer, any cancer, but we're obviously specifically focusing on breast cancer, younger than the age of 50, that's a young age of onset. And We look at the type of breast cancer. So if you've got a triple negative breast cancer, that's more likely to be hereditary, because the hormone positive breast cancers, you can sort of find an explanation for why it happened, because of the extra hormones. But with the triple negatives, that's hormone negative in a sense. We don't really know what the cause is, so they're more likely to be hereditary, but not all of them are. Then we also look at whether you've had breast cancer more than once, or if you've had breast cancer in both breasts. If you are a person who's had more than one type of cancer, so for instance, if you, as a woman, if you've had breast cancer and ovarian cancer, or for instance, breast cancer and colon cancer, because they're all related. And we also look at the rest of the family. So if you have many family members who has had breast cancer or associated cancers, so that would be the types of associated cancers would be anything really. It would be gastric, usually stomach cancer, or colon cancer, ovarian cancer, prostate cancer, even melanoma, the skin cancer, or even pancreatic. So there's a whole bunch of cancers that's associated with breast cancer by the genetic cause. We also look at your ancestry. So we know that certain population groups are more susceptible to certain hereditary conditions. So we know that if you are of Afrikaner ancestry, so that's like the Boere Afrikaans, that's what the Afrikaner means in this context, and the Ashkenazi Jewish population groups, we know that in those ancestry groups you have a higher chance of actually carrying a BRCA1 or BRCA2 gene variant that is the reason for your cancer. So I've mentioned all the types of clues that you can see. So now these are just clues. So even if you fulfill many of these, it's still not suggestive that you definitely have a genetic cancer. So how can you know that for certain? You can actually have genetic testing and counseling. So what are the different testing options that we have? So the first option would be, and this is only really for individuals that are of Afrikaner ancestry and Ashkenazi Jewish ancestry, and then we also have a causa founder variant in BRCA1 and BRCA2. So it doesn't look at the entire gene. So if you think of a gene as an instruction book that you basically read from the first page to the last page, with this particular genetic test, I'm obviously looking for any spelling mistakes in that instruction manual that causes that gene to not do its job, and the job of the gene is to protect you against cancer. So with this founder variant testing, what I do there is I don't read the entire instruction book. I only go and look at specific pages. So I will only go look on page 2, paragraph 1, and then I'll page further, page 10, paragraph 3, for instance. So it only looks at about between 3 and 7 gene variants, depending on the ancestry. It's a quick test, you get it back in 1 week, but it's not comprehensive. So if this test is negative, it doesn't mean that you don't have a variant in the gene, the BRCA1 and the BRCA2 gene. It just means you don't have these common spelling mistakes that we often look for. It is a cost-effective one though. So if you can't afford any genetic testing, or you want to see if your medical aid will pay for it, this is usually the one that the medical aids will cover. And it costs around 1,000 to 2,500 Rand depending on the medical aid, and it's done by most of the local laboratories. So PACSO is usually the major one that we make use of, but just be aware, as I say, the caution is always it's not comprehensive. So if you want a more comprehensive test, you can do the BRCA1 and BRCA2 gene full screen. So that is where we read the entire gene. So we read the entire instruction book from the first page to the last page. It takes very long if you do this locally in South Africa. It takes about 6 to 8 weeks to get the results back, and this is the most expensive test. I'm saying that it's between 10 and 12,000 Rand, but I actually got a quote the other day for 15,000 Rand for this test. So it's done through PACSO and AMPATH, The medical aid may cover the cost. They're not usually keen to cover the cost for this test, but because it's done locally, they might still consider it if you've got a very good medical aid. Now, the thing with this test is, if you now test negative for this, and then it means you definitely don't have a BRCA1 and a BRCA2 gene variant, but you might actually still have a variant in one of those other genes that I mentioned previously, because at this stage, we think there is about 28 genes that's associated with an increased risk for breast cancer. So even if you have this one done, it's still not comprehensive if it comes back negative. So the last option is always the best option. So you call it a gene panel, which includes all the known breast cancer genes, and it reads all of those genes from the first page to the last page. So this is the most comprehensive testing. The results is available within 3 to 4 weeks. The cost is usually around 4,000 Rand, or you can say $250 plus then a courier fee. So you can hear from what I'm saying about the cost is in dollars. So it's not done in South Africa. It is done in America through the in vitro laboratory. So because it's done internationally, the medical aid will not cover the cost for this test. So it will be out of pocket. I think it is a little bit more affordable than that 10 to 15,000 Rand test. And the other positive side about using this gene panel, this laboratory, is that if you are found to carry a gene variant that's causative of cancer, your family members can be tested free of charge. Free of charge for the testing, but they obviously might be liable for a courier fee. And the test has to be requested within 150 days from your results, and your family member has to be older than the age of 18 to qualify for the free testing. So yeah, I always say if you can afford it, this is by far the best one because it gives you a final answer to your question. So genetic testing is always goes hand in hand with genetic counseling. So why is that? So basically, the genetic counselor helps you to decide which test is actually appropriate for you and your family. And the genetic counselor will help you to interpret the results and to request the testing. Because the genetic test results, it's not always a yes or no answer. Sometimes there is a little bit of a gray area result that needs further investigation. A genetic counselor also does cancer risk assessments because your cancer risk assessment is not only based on your genetic test result, but it's also based on your cancer diagnosis. It's also based on your lifestyle factors because all of that plays a role. We are not only our genes, okay? We live in the world, we have environmental exposure, so all of that plays a role when we calculate your risks. And then obviously we would offer advice as to how to manage these risks and how to keep you safe from cancer. And we also do referrals to all the appropriate specialists that's needed in your care. And then obviously if there's a gene variant, then we assist the family members as well. So we assist them with testing. We obviously sit down and talk to them about it first because genetic testing is always optional. It's never forced. And I also feel like you have to want to know this information because once I give you your result, I can't take it back and I also can't change it because our genes are permanent. So I'm going to spend the rest of this talk basically just going through a few frequently asked questions. So that is also something that I would address in the counseling session. So when I usually get approached by someone, like what are the questions that they would ask? So one of the questions usually is like, okay, so I'm not positive for a gene. So what does that mean? So if you carry a gene variant that's causative of cancer, you have an increased risk of developing a second breast cancer and also possibly other cancers depending on the gene. It doesn't mean you're definitely going to get cancer again. It just means your risk is higher than someone else who does not carry a gene variant. So if you think if you have a BRCA1 variant, you would also be at risk of something like ovarian cancer and pancreatic cancer. For BRCA2, you will also be at risk of ovarian, pancreatic, melanoma, which is the skin cancer. And then for men, it's very important, the BRCA2 gene, because that also increases their risk for breast cancer and for prostate cancer. The ATM gene is also breast cancer, ovarian cancer, prostate, pancreatic. You've probably heard of the CHEK2 gene. With the CHEK2 gene, we sort of add colon cancer in that mix. And then I'm also just going to highlight the P10 gene. That's quite rare, but with P10 you have to think of your colon and your thyroid, for instance. So and your womb, the endometrial cancer risk. So whatever gene you have, it sort of gives us the information of what other areas in your body is at risk. And if we know that, then we can either advise additional screening. So for instance, for colon cancer, it would mean that you have to go for yearly colonoscopies from a certain age. We'll never remove a colon, and we also don't have to, because colon cancer usually starts off as a polyp in the colon. So if you have regular colonoscopies, they remove the polyp and it never becomes cancerous. If we see that there's a risk for a second breast cancer, then we would obviously advise having bilateral mastectomies with reconstruction rather than just having one breast removed or only taking out the lump. Okay. If we see there's a risk of ovarian cancer, we would remove the ovaries when you're a little bit older, closer to the age of natural menopause. We obviously don't want to do that surgery too soon. So we put all of that in place to try and keep you safe from cancer, to either make sure that you never get cancer again, or if you do, that we pick it up at a very early stage where it's easily manageable, and hopefully we don't actually have to give you chemotherapy again. If you have a positive gene, then you should talk to your family members about testing as well, because if you carry something, there is a 50% chance that you can pass it on to your children. And if you have it, then it means one of your parents most likely has it as well, because it comes from somewhere, and it's never usually in the person that I test and find positive for the first time. It's usually from their ancestors, so it would be their parents' parents' parents. So it's important to inform the family so that the parents can be tested, the siblings can be tested, and the children can be tested. So another question that I often get is, what about my daughters? So I now have breast cancer and I have a gene. So what about my daughters? So your daughters can be tested from the age of 18 years. We don't do the testing sooner because we feel it needs to be your own choice. It needs to be a personal choice, and we feel individuals younger than 18 years, usually we feel like we don't want to burden them with having to make that decision, because you already have to make quite a few decisions when you're that age, like life decisions, especially from the age of 18. And we don't have to do it sooner because your cancer risks aren't very high at that age. So for instance, if you have got a BRCA1 to a BRCA2 gene, we don't really start screening for breast cancer before the age of 25 unless there's a family member who got breast cancer at a younger age. So you can wait until they're 18. If they're positive, then obviously the genetic counselor will calculate their personal risk and advise on the management options. If they haven't completed their family yet, then they obviously don't have to go for the surgical options yet. So we can sort of guide them with additional screening. So usually it would be 6 monthly follow-up from the age of 25 until they've completed their family. And then we'll discuss the option again of rather having the bilateral mastectomies with reconstruction and also having the ovaries removed, but much later on. So the ovaries we usually only remove from the age of 40 onwards, because if we remove that, we put you into menopause. So if they test positive, it doesn't mean they have to go for surgery. We can do the screening until they're ready to go for that and they've completed their family. The other thing is, if we test your daughters and we see, listen, they don't carry this gene, then they don't have to be worried about the risks. Because if they don't have it, they are not at increased risk. And also, they cannot pass it on to their children. So then you don't have to worry about your grandchildren. And the other important thing is, I've never actually had, or I rarely have a family member or a lady with breast cancer ask me about her sons. It's usually, what about my daughters? Because we think breast cancer, we think women. As I've mentioned, men can also get breast cancer. So if there's a gene, it's important to tell your sons about it as well. Because there are cancer risks associated with that gene that isn't just breast cancer. So even though with BRCA2 there's a male breast cancer risk, and some of the other genes there's also a male breast cancer risk, but with many of these breast cancer genes there's also a prostate cancer risk associated with it and other cancers that we need to look at. So we also need to think of management plans for them. And then very importantly, if the sons carry it, they can obviously pass it on to the next generation. So if they have daughters in the future, then their daughters will once again be at a high risk. With the BRCA1 and the BRCA2 genes, for instance, your breast cancer risk is between 80 and 90% if you carry those genes. So if you have a daughter, if the son then has a daughter, her risks will be high again. And you don't want to miss out on that opportunity for her to have that information and be able to make that decision to rather have the surgery before she gets cancer. Another question that I get quite often, sorry, we just click, is that I would have ladies ask me, listen, I've had a negative BRCA test, so does that now mean that my cancer is not genetic? So the answer to that is no. So the thing is, as I've mentioned, the BRCA1 and the BRCA2 genes is just one of many genes that can give you breast cancer. So if you've only had the BRCA founder testing, which I mentioned, which is only the specific variant in the gene, then you can still have a BRCA1 and a BRCA2 pathogenic variant. So you would still then have to go for additional testing. If you've only had testing for BRCA1 and BRCA2, even if it is the comprehensive screen that you've had, there's still a possibility that you can carry a variant in one of the other genes. As I've mentioned, at this stage, there's about 28 genes that we know of. So I just took a screenshot to sort of show you the other genes. So you'll see at this stage, there's 14 primary genes that we think of, and those are the main ones that I've mentioned. So if I look at the families that I've seen, if it's not BRCA1 or BRCA2, then it's usually an ATM. I've seen quite often, I've seen CHEK2, NBN, PALB2, and then RAD50 is usually quite common in our population. So, and interesting enough, MUTYH as well, and you'll see that's one of the preliminary genes, preliminary evidence genes. So that's why I say this is always the best option, these comprehensive panels. So then I also get asked this quite often, is I'll have someone and I will test their mom, for instance, and their mom won't have a gene, and then they'll ask me, but can it actually skip a generation? Because now my mom doesn't have the gene, but what if some of her other family members also now have cancer and then she doesn't have it, but maybe I've got it? So the answer is no, it cannot skip a generation. But what does happen is, and I sort of show it in that picture there, is that you must always remember that these genes work in pairs, because we are half from our moms and half from our dads. So for every single gene, so even for the BRCA1 gene and BRCA2 gene, you have one copy from your mom and one copy from your dad. So if you don't have a genetic cancer, it means you actually have two healthy copies. But you can still get cancer because our genes are susceptible to DNA damage from the environmental exposures. So if you've got two healthy copies and then after a few years the one gets damage on it, you're still good because you've got one backup copy. So only much later on in life, when both are faulty, will you develop cancer. But if you are born with one faulty copy and you have one healthy copy, so this is what you will look like if you've got a genetic breast cancer, then it means that obviously as you live life and you are exposed to environmental factors, this one will lose its function after a few years, and then you've got nothing protecting you. So you are less protected if you look like this than if you look like that. So I'm explaining this because this is how it can seem like it skips a generation, because someone can actually look like this. They can have one faulty gene copy and they can have one healthy gene, but they can live their whole lives without this healthy one losing its function. So there are family members in the family where they'll carry exactly the same genetic change, but the one person will develop cancer in their 20s or 30s when this one has lost its function, and another person, this one will actually stay healthy until you're much older, when you're like 70 or 80. So then you can get that illusion that it's actually skipping a generation. And the other thing is also, if you look like this, you don't give both copies to your children. Your body sort of decides which copy it will give. So if you now pass on the healthy copy to your children, it also looks like it's skipping a generation, because that branch of the family will not get cancer from it. But if you pass on this one, they will get cancer. So that's the other thing as well. Not everyone in the family carries the gene variant, because it's 50-50. So if a parent has it, it's a 50% chance they'll pass on the faulty copy, 50% chance they'll pass on the healthy copy. And I think that was pretty much my last general question that I usually encounter. There's actually one important one still. So I also get asked, why have a genetic test if there's nothing I can do about it? So I've basically had this gene variant from birth. So you can't fix the gene, so why? Why is this important? So the thing is, yes, you've had it since birth, but we couldn't protect you against your first cancer because we didn't know about it. But if we know about it, you once again gain control over your own body and your own risks, because you then have the upper hand, because you know what areas in your body is at risk. So you can do additional cancer screening to make sure that we detect a new cancer very early, so that you can possibly skip the chemotherapy stage, or you can have surgery, so the bilateral mastectomies rather than just the one mastectomy, to make sure that you don't get breast cancer again, or you can have your ovaries removed to make sure you don't get ovarian cancer. And also, if you have cancer, and that cancer is because of a particular gene, especially now the BRCA1 and BRCA2 genes, there's actually alternative treatment options available for those specific types of cancers. That's very much true at the moment for ovarian cancer that's caused by BRCA1 and BRCA2. If you've got ovarian cancer because of those genes, we can consider other chemotherapy that we wouldn't be able to offer routinely. Also, if you have this information, yes, we couldn't save you from your cancer or your first cancer, but we can potentially save your children and other family members from ever having to get cancer and having to go through chemotherapy and radiotherapy. So that's why it's still important to consider it, even if you think there's no value for you in having it. With these genetic things, you have to think about the rest of the family, because it might be helpful for them and you might be able to save them from going through a cancer diagnosis. And I think this is definitely my last one. So just to sort of summarize what I've been saying, so if you think that there is a possibility that you have a hereditary type of breast cancer, it is important to speak to your doctors about advice regarding your risks and the testing options. If you've already had a genetic test, just make sure it was a comprehensive test and that everything was tested for, and that that test isn't giving you false reassurance. Also, genetic counseling and testing can be potentially life-saving for you and your family members. And if there is a genetic cause of the cancer in your family and we are able to identify that cause, then we can test the other unaffected family members to make sure that we either prevent the cancer or we detect it quite early. And also remember, there are new treatment options that is becoming more available if you are gene positive. And I think that's pretty much my message for tonight. So yeah, thank you for inviting me and listening to this story again. So
thank you very much. That's very interesting. Thank you, Dr. Scott. I don't know if there's any one of our viewers who have a question for Dr. Scott. You're more than welcome to email, send it in, or ask us. If you want to unmute yourself. No one has a question. I think there was something we spoke earlier about if there's a genetic cancer. Actually, you did sort of refer to it already, but in terms of the South African context, why is it that there's a specific genetic cancer that's more prevalent? How do you pronounce that word? Prevalent. Yeah, we're sorry, you have to excuse us. English is it's our second language for all three of us. Yeah, but in South African context, how does that happen?
It's sort of where where we originated from, and I know we spoke about this earlier. So we know that a lot of our Afrikaners, we sort of originated all from Holland or from like the same little colony. So because we were sort of a small colony and we sort of in the same, lived in the same area. So it means that we all carry similar genetic changes that we sort of got from the environment that we were exposed to. And one of it just seems to be the BRCA1 and the BRCA2 genes. The same with individuals who are Ashkenazi Jewish. They used to marry individuals that were similar, that were also of Ashkenazi Jewish faith. And because I always say the more similar you are to each other, the higher the chances that you carry the same genetic changes, because we all carry genetic changes and every population group has a higher risk for certain conditions. The Afrikaners, breast cancer is one of those things for us.
Sure. And English-speaking South Africans, and is there a specific?
Well, it depends on what your heritage is. You know, you can be you can be English-speaking, but you have a oma and a opa. so yeah, if you are like British, for instance, it would be a different condition. It would be something like cystic fibrosis that we're more worried about. It won't really be the cancers. But I also have to note that many of these new cancer genes that we've identified, they're very new. So we actually don't know in which population groups they're very prevalent. We don't know that yet. We're still figuring it out. We're also trying to figure out what are the most prevalent other genes in our South African population.
I have a question.
Yeah,
a friend of mine recently asked me when I spoke about you, and she said that in the family history, there's quite a lot of cancer, or there was, different types between men and women who they're all brothers and sisters who suffered some form of cancer, and it seemed like it skipped her generation, but she was quite concerned about her daughter. She also has a son, but her daughter is past the age of 18. I think she might be 22, 23, I can't remember. And she was wondering if it would be worth it having her tested. I would now tell her to listen to your presentation about the generation that it skipped, but it can also bring down a positive or the negative gene. But would you advise, or would you suggest that they maybe do a test like that, even though there's not immediate cancer showing up, but the fact that the family was there was a widespread of different cancers?
Yeah, so that's actually a very good question. So if we see that you've got many different cancers in the family, there's a genetic test that you can actually do that includes all the cancer genes. So it's not just for breast cancer. Okay. So if you have, for instance, a lot of prostate cancer in the family, a lot of colon cancer, other types of cancers, and it's a widespread of cancers, then that's probably a good option. And yeah, it would be best if your friend is tested first before we test her children, because if it is on her side, if we test her and she doesn't have it, then obviously she won't be able to pass it on to her children. The ideal is always to test a person who's had cancer, because the idea is that if I test the person who's had cancer and that person doesn't have the gene variant, then I'm probably looking in the wrong place. And if they do have a gene variant and I don't have it, then I'm definitely safe from the cancer. Because I know what the cause is and I don't have the cause. But if I don't know what the cause is, then it's difficult to predict what the risks are for the other family members. But there is a lot of people at this stage that they either not sure what their family history is, or they were adopted, or it's a little bit iffy or unsure, or both of their parents had cancer, and they're perfectly healthy. Then they come for these genetic tests to see do they carry any of these common gene variants. And I've actually found it. There's a few people that I've actually found something in that we could action, that we could keep them safe. So I always say, if you're worried and you're asking the question, at least the testing is now quite affordable. I don't think all of us have like 15 to 30,000 rand to spend on a test, but it's easier to actually get 4,000 rand or to spend 4,000 rand on a test. And also, if you're doing it for the family, you can always tell the family, listen, I'm doing the test. If they find something, your test will be free of charge. So then they can always contribute.
Sure. Thank you.
Okay, thank you. I think, Liezil, I'm going to pass the mic over
My
to
moment.
you.
Yeah, well, I'm a survivor. I'm a warrior of breast cancer. I was diagnosed in October 5 years ago, this coming year, and here I am. I see myself as being one of those people to carry the message forward of hope, that there's hope. You gave me a very good pedigree of what I do and who I am, but I am just a mother and a wife. And breast cancer caught me completely off guard. There's no history of breast cancer. I didn't have a lump that I felt. It was just one of those unpredicted diagnoses in my life. And I made a decision to keep focusing on the positive side of this, and that's where the NPO came, of Women of Hope. But if I could maybe tell a little bit about my diagnosis first, and just tell what my journey entitled, or what it was all about, and still currently is like we spoke earlier, unfortunately cancer never leaves you. Although you're a survivor and a warrior, it's one of those things. In my case, mine is hormone driven, or fed by my hormones. Well, then now the lack of it. Well, I hope the lack of it means that it's all past tense. But yes, that it was a complete unexpected diagnosis, and
So you went for a routine mammogram?
not actually. It's a funny story, if we could put it that way. I've actually had an annual routine mammogram since I was 40. I was diagnosed at 44, and it just didn't show, or there was nothing that specifically put off alarms or made us worry about it. So my husband and I slept in a hotel one evening on a business trip, and while I was getting dressed to go out the evening, he noticed that my breast showed a very funny, it's like almost pulling in action. I best describe it if I bend my knee, that little soft orangey skin that forms next to your kneecap. That I think that's where it says that it's like orange peel that you can find it, and that's the way it looked. And like Dr. Etienne described or explained to me, I had 3 tumors that went almost inside the breast, and it didn't come to the outer part of it. That's why I didn't feel a lump. So the sucking action was actually from the cancer pulling inside, if that makes sense. And like I said, I had 3 tumors, and I didn't feel a sin. And I had quite large sagging breasts, like most women have. I mean, probably our age then. I have 3 sons. I breastfed them, so I actually just thought that was now part of the next look towards what ends up with bigger breasts. And I didn't give much notice to it, so I eventually went for a complete different checkup at just a general doctor. As a photographer, I thought I had a tennis elbow or something, was just from carrying the heavy gear. And I still made a joke, and I said that, I'm here for the full tutti today. I'm going to spend maximum on this consultation, and which ended up, and obviously in a complete different story. But the long and the short is that I realized that it happens to just everyday normal women, mothers, working mothers, as there's no history of breast cancer. It wasn't something that I was alert of, like you just mentioned. And I also come to realize that it wasn't necessarily something I did wrong knowingly. Looking at all the different factors that you've shown in your very first slide, there's a few things that I would, if I had conversations with younger women, make attempt to, especially preventative medications and all sorts of stuff that you put your body in what's the word? Like I said, we're all Afrikaners here. But you put yourself in a position that you expose yourself to it, and you don't even realize it. But but what I want to bring forth from this is that there is really hope, that all cancers doesn't necessarily mean that it's the end of the world, or that there's death immediately towards it. To me, it was an enormous shock, and like I said, unexpectedly. And the first thing that hit me was, what about my children? They were too young to be without a mother. Couldn't imagine my husband being left with 3 boys and not having me there. And I just made a life decision that I was going to do everything possible I can to extend living. And with diagnosis, people come in with the best of advice, and you will get emails and Facebook messages by saying, now you've got to eat blueberries, and then it's cucumbers. And I know people mean it very well, but all the information that you've just received is so overwhelming that you are just focused on what your doctor tells you. Yeah. And I still consider myself as very privileged to, in a very short time, be able to become one of Dr. Meiburg's patients. Dr. Lizana is my oncologist. Dr. Geldenhuis, just the whole package. And I've considered myself being in the best possible hands. I was diagnosed the 31st of October, and my operation was the 14th of November. And to me,
that's first world treatment.
First world treatment. And someone once asked me, who's your house doctor? I said, I don't even have a house. I've got an oncologist, I have a plastic surgeon, I don't have a house doctor. So, I've really considered myself being in the best hands there is. And part of that decision was that I decided that I was not going to open myself up to anyone else's advice than what they guide me to follow and to do.
And I think that's a very wise decision, because if you have to listen to all sorts of it all around it causes a lot of additional anxiety and uncertainty, and
and
which you don't really need.
No, and although Google is a very good help, I remember I started reading, and then I just decided that this is a death sentence that they are giving me, and I'm not going to accept it. So yes, so here I am today, and
Thank goodness you didn't accept that
yeah.
diagnosis, Dr. Gundel's diagnosis.
So as part of this, I'm a very practical person, and I don't know half of the information I'm most probably that I need to know about this whole journey. To me, that is sorted by the doctors. So I got into the practical sense, and I saw a need in hospital when I was there. I had a double mastectomy, and I was left in a luxurious private room, but I had all these drainage and pipes part of my being for that week. And as part of the recovery program, I had to do a bit of physio. I had to walk to the bathroom like any other normal human being do. And I needed help with all this drainage. So I phoned my sister and I said, just scratch there in your daughter's cupboard for a little handbag or something just to put this in so that I can have my hands to use. And she did bring it to me, and then much later, after a meeting with Dr. Langenhofen and Laurie Ann from Hatspy Laurie was also involved, and we had a chat about this bag needed, and I decided to bring in, as part of my journey and my message of hope, the journey bag. And it's a bag that is issued for your journey, and whether it's to use during your mastectomy or when you go for chemo, it's there to assist you, practical, and also to just remind you of that message of hope.
Sure.
And these bags are all made by volunteers. Either people donate material. In most of our cupboards, there's an odd
Extra piece
meter or something that you've meant to use for a skirt or a blouse, and you end up, or you never actually made anything with it. And that's the kind of donations that I accept. And then there is some women who have the ability to do needlework, and they do the stitching of the bags. I actually brought a bag to show you.
That's beautiful.
And if I may demonstrate it, just how we use it, I'm going to try and fit into the camera as well, is that while you're in hospital, it's from a nice soft material so that it's not heavy on the shoulders or any parts of the body that is aching from the operation. And the inside is ideal for your drainage that comes out. Or I've also given one to someone who had a stomach operation with cancer, and hers came from her nose, all the pipes. So it doesn't really matter which way, it fitted into the bag, and it gave them the opportunity to have their hands free to either be part of the physio. I remember I had to make little movements and hold these pipes and just get forward there.
Sure.
So inside there's a side pocket for your water and your keys and your phone, and yeah, so it's really just a joyful, happy bag to make life easier for you. And we give the bags to PACSO, Dr. Langenhofen and Dr. Myberg, I know make use of it. They would give it to their patients. And then also some of the physios would also issue their patients. It could be that they're not part of this doctor team.
And is there any cost involved?
No, no. If anyone feels that they would like to make a contribution, then I would suggest to go buy material instead of giving a cash contribution. Or if you've got the ability to do needlework, then I have patterns for this. And then this also grew into Dr. Langenhofen saying that she would like to have a little bag that she just gives specifically to the chemo patient. So there's nothing more to this than just a gesture of love and of hope. So she would put the first medication in this. I include a little note. Sometimes I have people who write messages, or there's just it just comes with the whole warm-hearted message that you are loved and you are cared for by someone.
Oh,
And it could be that you don't know them, most probably, but otherwise that it's just that you're not alone, and that there is normal everyday women struggling with the same journey. Yeah.
And that they care,
And that they
want
care.
to just
Yes.
do
Yes.
something nice for you in
Yeah,
such a difficult
I have
time.
found that there is friends who don't know what to give a newly diagnosed friend or family member, and what they really want to give over is also that message of hope and love. And they can contact me or they can contact the practice, and we always,
I
make
think
a plan.
that is so amazing, because when you're going through such a deep, a very dark and difficult time, I think that tiny flicker of light, I think there's a saying, or just a little match, the light of a little match can drive away the darkness, and you can see it from such a far a distance away. You can see that little light, and I think in a situation like that, when you are in such utter deep darkness of despair of having this shock of this diagnosis, that is, I think that is just such a spark of light that can make such a big difference.
Big difference, yes. I've just realized that it just takes a small token, to make a big difference. And for me, it was doing something practical as well, and not. I think there's quite a few NPOs who support underprivileged, or they do hospital visits, but I've realized that even if you're in the best financial position there is, you don't necessarily know that you need a bag like this.
No,
And
I didn't know that
yeah,
that
and
could be
then
something
it
that
could
be
just
so useful.
it could, and if you don't use it on your journey, pay it forward. When you come
Yes.
out of your hospital room, pay it forward to the next person.
So tell us, what can people do if they want to contribute and they want to really?
Well, I have a Facebook page called Women of Hope, and it's a single woman, as my message is that you as a woman are the message of hope. We as women stand together, but that you alone can make such a big difference in someone else's life. And you're welcome to message me through the page, or as Breast Cancer Month is next month,
around the corner.
I am going to try and do a little campaign of asking people and friends just to go scratch in their cupboards and see if there's the beauty of this journey bag is it really takes 1 meter of material. And it's not a lot. No, it's not a lot. So, and I know I don't even do needlework, but I love material, and has been so much in my cupboard hoping for something. So, I actually want to challenge people to say that, go look and know that you can make a difference in someone's life by with 1 meter of material.
And it doesn't have to be pink material.
No, not at all.
Color.
I must confess, I have received so many donations of material that I thought was really not my kind or my style or my liking at all. And then people would walk in and say, "Oh, that's the most beautiful bag." And that just made me realize that it was not about me, not at all. So Women of Hope is really not about me. It's about you being that token. And so even if
you don't like the material, then you
can
can
someone else would like it.
Like it. Yeah.
My very first bag that I given out was a dummy bag made of bright yellow material with bees. It was actually my eldest son is 17 years old, and that was his baby's room decor. And I brought it to Dr. Langenhofen to show her, and she absolutely loved it. And she said that, "Oh, it's so joyful and pretty." So we went and we gave it to a patient. And I was almost shy about this friendly, happy bag in this miserable time. And the joy that it brought to that patient's face just made me realize that anything goes.
Yes.
We're a bunch of wonderful beings that love different kinds and stripes
Yeah.
and flowers and checker boxes.
Yes.
So yes, so
Oh, but that is really just so amazing.
thank
I
you.
think it can really just, like you say, just make such a difference
Yeah.
in someone's life when you go through something like that. And I would really like to ask all our viewers to please just go and visit Liezil's it's your web page.
I have a Facebook page at the
Facebook
moment.
page.
Yeah,
Women of Hope.
Women of Hope.
And more details will be provided there, more information on how you can go about to make a contribution, to just also bring a spark of light in someone's life who's getting a cancer diagnosis and going through a difficult time. So that's really a wonderful story.
Thank you.
And I think it's also a good idea that now that we're getting closer to Breast Cancer Month, that people can hopefully take it even more seriously to try and do something to make a difference in someone else's life. We are also planning on doing something special here at Panorama Center for Surgical Oncology, but we will be posting some more information on that as soon as possible. So just have a look on our Facebook page and website probably as well. Yes, Ruben is nodding his head, so yes, details will follow. Is there anyone who has a question that they would still like to ask either Liezil or Dr. Scott, or would you like to have something else to add or to say?
I just think the bags are amazing. I was also thinking, because you were saying about your son that you were recycling something. So I was thinking, like, maybe do I have a dress that I can't fit into anymore? That'll have new life and be meaningful to someone else.
Yes.
Yeah. If there's not a specific question, I would also just like to send out the message to. I'm sure there'll be a few followers who'll be watching this later again. That don't underestimate what you can mean to someone else, and don't ever feel alone. What I've found in this last 5 years is that I've made wonderful new friends as well, and we still need support, and we still need to talk about this journey. It's often a topic that is avoided because people don't know what to say or what to ask. And it can be a lonely journey as well, but don't make it lonely for yourself, and don't feel that there are people out there who doesn't understand, because there's more of us that is really there for support. And even if it's just having a cup of coffee, or nowadays a Zoom call or WhatsApp call, make use of it. And I've often said that maybe I can't answer all the necessary questions, but I've met so many people in this past 5 years that I can put you in touch with. So make use of it, and share this videos that's on your websites, and so that you can just guide someone to know that they don't have to be alone. There is support out there.
Yes. Thank you so much, Liezil and Chantelle, for just on this actually start of the long weekend, being prepared to share your story and wisdom and information with us and knowledge. I'm sure there's a lot of people who really, really appreciate that very much. And I think all the best for everything that you do and with your non-profit organization, and also Chantelle, you with genetic counselling. It's really an amazing field, and I think, like you said, it's a way of actually saving lives. Knowledge is power, and it's definitely something that I hope more people will consider doing, is getting that genetic test and hopefully saving not just your own life but also family members' life. So thank you and good evening.
Thank you.